Good morning. Am I audible? Great. So good morning to all. We are starting our reading club with the prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जय से पहले खुद को जय करे, हमको मन की शक्ति देना.
Good morning to all. We are giving tribute to our great master, Dr. Samuel Hahnemann, for wonderful divine science as a gift to all of us and taught us dare to be wise. Seeking blessings from our Guru, Dr. Prafull Vijayakar sir, who have bridged this divine science with the modern science and made homeopathy like mathematics. Jai Hahnemann, Jai Homeopathy, Om Vijayakar. So friends, we are in the journey of understanding and reading the wisdom of Master Samuel Hahnemann from the 6 editions of the Organ of Medicines. So up till now, we have understood that in local maladies and local diseases, what to do and what not to do. So in continuation of this, we are in the aphorism number 194. It is not useful either in acute local disease of the recent origin or in a local affections that have already existed a long time. So it is more of acute or chronic, both. It is not useful to rub it in or apply externally to the spot an external remedy, even though it be specific and when used internally salutary by the reason of its homeopathicity. It is not useful even although it should be at the same time administered internally for acute topical affection, for example, inflammations of the individual parts or erysipelas, etc., which have not been caused by external injury of a proportionate violence, but by the dynamic and the internal cause. Yield most surely to the internal remedy homeopathically adapted to the perceptible state of the health present in the exterior and interior, selected from the general store of approved medicines, and generally without any other aid. So this is very important. So anyone says that even in acute local disease or in a chronic local disease, you cannot apply topical applications to particular spot, especially of the inflammatory origins or erysipelas. So even though your medicine is specific to that, so do not apply. This is what Master Hahnemann has mentioned. But if disease do not yield to them completely, and if they still remain in the affected spot and in the whole state, notwithstanding the good regimen, so in spite of giving good regimen, a relic of the disease which the vital force is not competent to restore to the normal state, then the acute disease was. Then, if it is not not yield to this treatment, then the acute disease was as not frequently, that means as frequently happen, a product of the sora. So that must be treated as a sora, which had either to remain latent in the interior but has now burst forth and is on the point of developing into palpable chronic disease. So sometimes you need to prescribe an acute remedy for that, and after that the acute outburst has been reduced, then you need to prescribe the antisoric remedy, that means the constitutional remedy. So that is what Master Hahnemann has said about. So in continuation to this, that in order to effect a radical cure, specifically in the local maladies and the local disease, in such cases, which are by no means rare, that means frequently happen after the acute state has pretty well subsided. That means what Master Hahnemann says that the acute state has pretty subsided, an appropriate antisoric treatment, as taught in my work in the chronic disease, must be directed against symptoms that remain still and the morbid state of the health to which the patient was previously subjected. So that means very important, and in order to effect the radical cure, हमें क्या करना है, तो एक्यूट स्टेट जब हुआ, उसका जो मेडिसिन दिया है उसको ठीक हो जाने के बाद हमें पूरा केस लेके उसको एक एप्रोप्रिएट एंटीसोरिक, दैट मींस द constitutional remedy has to be prescribed on the basis of remaining symptoms and the previous history or a past history of the patient, so that you can cure radically. In a chronic local maladies that are not obviously venereal, the antisoric internal treatment is alone requisite. That's all. So, moreover, in a chronic local maladies not arising from the psychosis or not arising from the syphilis or a venereal disease, in that case, only antisoric remedy is the treatment part only. But if it is arising from the psychosis and the syphilis, then you must yield to the another treatment plan. That is acute state remedy followed by you need to prescribe the antisoric remedy. So this is what you have to understand in this phase. So this is what a simple wisdom of Dr. Hahnemann to all of us, how to deal with the certain cases in this way, and then you apply this into particular. So the concept of what the GCS and the state remedy and the acute remedy or the pathological remedy, the different name has been there. That was only and only given by Master Hahnemann to understand the patient and to radically cure in the same way. So he had given a clue that you need to prescribe on the basis of this. And now further continuations of our understanding and the learning and the reading of our genetic materia medica by Dr. Prafull Vijayakar, sir. So in this book also we have as far as covered what is the genetics of the persons. So to understand according to Kantian method, the will, intellect, moral attachment, sensitivity, and the physical generals and the physical particulars. So these all are governed by the genes. Followed by we have understood the group of remedies that help us to prescribe in our day-to-day clinical practice. That is the Baraita group, then followed by the Kilperia group, and then the Kali groups, and then we are continuing with the carbon remedy. So day before yesterday, we have learned about the carbo wage, and today we are starting with another remedy, that is graphitis. So graphitis is also a carbon. As we have learned, in short, the carbons are the right-sided, timid, anticipatory, slow, lingering disorders, and the disease started from the acute violent outburst and followed by the patient goes into a slow chronic disorder. This is what we have learned in the carbons or carbovage. What is the difference between these carbons and the graphite? So starting with the graphite, so the mnemonics of the graphite is a GRAPHITES that represent a certain symptomatology. So the first symptoms of the G is represent the gluey discharge, that means the honey-like fluid discharge. So whenever you find a honey-like or fluid discharge or a gluey discharge in any of the orifice or the external appearance of the disease, you can just think of the graphitis. Then the R represent the riding in carriage aggravations in general. So most of time the riding in aggravations is the indications as a sensitivity of the particular persons. But one peculiar symptoms which is there in the graphitis is hearing ameliorated by riding in the carriage. So how can we see this in our clinical practice? So patient was saying that in a silent atmosphere or in some atmosphere, patient says that I cannot hear properly. But when I used to travel by a train or I used to travel by car, I can hear properly, and there is no even though noise can make me hear properly. So this is what something the hearing converted by riding in the carriage. A represent the anxiousness. So most of time we know that the all carbons are the anxious, anticipatory anxiety, and the graphitis is one of the anxious remedy with the feeling of weeping. So graphitis represent like pulsatilla. Again, the P represent the pulsatilla like the changeability. That means the wavering mind, the indecisive mind, the inconstancy, and the pain also wandering on the touch. So that is what the graphitis is. Then the hardness. So hardness is very, very important. So most of time when you find that there is a fibrin excess in the body, which gives rise to a hardness. So in graphitis, the graphitis gives rise to hardness. So hardness of everything in the body from skin to organ or but the mind is soft. So this is very important that hardness you find at the physical level, but the mind is so sensitive and mind is so soft like Volsibilla. So when you have the combinations of the disease at the physical level is hardness and the mind is soft, you can think of he might be a graphitis. Then the I represent the indolence and aversion to work, though intelligent, slow and lethargic. As you all know, all the carbons are the slow. Then the timid and the tumorous conditions. So T represents the timidity. Then E represents the eruptions, the scaly, the cracks, plus fissures on the skin. So this is something you have to understand that whenever you are dealing with the cases of the skin eruptions and you find a three components, there is a crack, fissures, and the scales. Most probably you can find all three in cases of the psoriasis, in cases of the chronic eczema with cracks and everything, in cases of the plantar, palmoplantar keratosis and everything. So whenever you find these combinations, you can just think of the graphitis is one of the indications. And S represent the sarcastic. So very important understanding that whenever the person's coming to your clinic and they are talking in terms of sarcasms, then you can think of he might be a carbon remedy or he might be a graphite. So what is the meaning of sarcasm? So Dr. Vijayakar sir has given a wonderful meaning of sarcasm in the book Frequent Encounter. So the rubric was given is the sarcasm, mocking and sarcasm in the combinations in the repertory, but actually the difference of both rubrics or both words is different. So we have to understand that rubric in this manner, and we have to interpret this patient's behavior very carefully to select the remedy. So that is very important. So mocking and sarcasm are the two different attitudes, and obviously the remedy and the constitutions related to both are the different under the same rubric. So what could be the thing behind that? The mocking has something to do with putting down or humiliating the person. The constitutional type that do not show that they have an egoistic and haughty attitude, and the remaining person in front of they, so they have to putting down someone else or humiliating else. So most of the remedies will be those who hold themselves in a high self-esteem positions, so they can move on someone else, like paracetamol, platina, ipecac, china, legacy, nux vomica, arsenic, scan, ignition, etc. Or sometimes the persons who cannot understand and having a foolish ego, so they may be a hyosamous and pedis quadrifolia. They also do mocking, or sometimes the very mischievous kind of personality and making the pranks on someone else, and that is what hyosamous tarantula lactis is. Or sometimes the persons who is high self-esteem with the truth tell the plain, and that is what the chocolate enemy is. So this all remedy goes into a state of the mocking to everyone. But on the other hand, what is the sarcasm? So sarcasm is a different meaning. That sarcasm has the nature emanated from the more of a timid constitution. So constitution which is very timid in characteristics, and they try to express their inner resentment, inner anger, or inner hurt in the form of a indirect way or a sly way, and they indirectly taunt or hit back to someone else. So that is what exactly the sarcasm is, and the carbon is one of the trademark remedy in the sarcasm with the timid constitution. So this is what you have to understand. So here a dictionary meaning of the sarcasm is that is sarcasm means the irony, satire, a caustic remark. So the witty language used to convey insult or the scorn. So most of time intelligence is there in sarcasm, and they have to convey the insult or the scorn they feel. So that is what the sarcasm is. So here I would share with you one of the video of a sarcasm so that you can understand it in a proper way, how the person is sarcastic to all of you. So I'm sharing this video. Uh, Listen this video, and you can understand that how one of the political personality tells to different personality in terms of sarcasm. So this is the video. Hope the video is visible to all of this video is visible to all. Is video screen is visible to all? Yeah, okay, fine, that's great. So listen this video and you can understand how sarcasm is the process. So So, how the person, mostly in a political background, the person is talking in terms of that I am not satisfied with you, or I want to express my resentment, my hurt toward this, and that is what in an intelligent way, and by looking into verse, making into verses and everything. So, whenever you see the rubric, verses make the carbo wage is one of the remedies that verses make. So this is what how sarcasm is represented. So sarcasm is a timid way of expressing their hurt and resentment. So I will share with you the another mocking sarcasm video, and that is what a very important. This first one is the sarcastic speech, typical sarcastic speech in terms of the feeling of insult and scorn. Whereas this was the mocking sarcasm, so that is helping you to understand how the person is talking to you in a jesting way. But the behind that jesting, there must be some sarcasm in the mind, and that is what he is expressing. So I will share this video with all of you. This was one of the comedians in our Indian continent, and he is sharing his comedy shows to all of us. But this is what you have to understand how the expressions of the sarcasm and mocking in front of.
अभी राजस्थान में कुछ साल पहले सलमान खान ने हिरण मार दिया। बेवकूफ आदमी है, इतिहास की जानकारी नहीं करेगा तो यही होने वाला है। सलमान खान को मालूम नहीं था कि रामचंद्र जी हिरण मारने गए थे, बाद में कितने पापड़ बेले थे अगले दिन। सारा झंझट हिरण मारने के बाद ही तो शुरू हुआ था। उसकी सीता गई, इसकी ऐश्वर्या गई, उसकी तो वापस लौट भी आई, इसकी तो कोई उम्मीद भी नहीं है। बेवकूफ था सलमान खान, हिरण मार दिया, जमानत नहीं हुई, आदमी मार दिया, उसी दिन जमानत हो गई साहब। इस देश में आदमी की कोई कीमत नहीं, जिसे जब जहां चाहे जहां मार दो। सारे मानव अधिकार आयोग इस देश में दानवों को बचाने की चिंता करते हैं, मानवों को बचाने की कोई चिंता नहीं करते। अभी राजस्थान में
See, look at this, how the persons convey this sarcasm to the world, and that is what his expression is. So his expression is like this, that he is talking about the laws and the injustice happening in the Indian continent because of this reason, and that is what he is expressing in a mocking way. So this is a typically a sarcastic remark, and the sarcastic peoples are talking in terms of. So many a time the patient comes to your clinic and they say, "Yes, sir, I know homeopathic medicine is very good, but it cannot work in my way. How can?" So you are a good doctor. So person is also sarcastic on you also. So you have to keep an eye on the behavior of the patient, and then you can understand that how the person is sarcastically remark on you, in spite of not getting results and everything. So this is what the carbon peoples are sarcastic. So going further into it, so the graphitis means the plumbative, the graphitis is the combinations of the two elements, that is one is the carbons and one is the ferrum. So the constitutions of graphite is in allotropic form of a carbons, but has some percentage of the iron ferrum in it. This causes the graphitis to have a property of the carbon as well as the ferrum. So that is what very important understanding, that the carbon is very, very slow and soft, whereas the iron that is a hard. So that is what there is a hardness at the level of the body as well as the softness at the level of the mind. That is the combinations of the graphites from carbons and ferrum. So you can understand from the basic point of view. The property of the carbon, so we can understand that the property of the carbon is a slow, chilly, indolent, aggravation heating after emulations in open air or air hangars. Mentally, we are very, very anxious, timid, and sarcastic. Physically rounded with the hardness of the skin, glands, cracks, and the fissures. These are the few point of the carbons. Then how graphite is differ from other carbons. So as we see that the all carbons are the right-sided, but the graphite is one of the left-sided remedy, because the sensitive metal, the ferrum is one of the sensitive metal, and there is a sensitivity. So you all know the sensitivity of the ferrum is sensitive to slightest noise, or even sensitive to contradiction. So this is what the ferrum is. So due to that iron content in the graphite is a left-sided remedy, whereas all carbons are the right-sided. So all carbons are non-sensitive, non-emotional, but the graphite is more sensitive, more emotional, sentimental, full of grief and weeping time. And that is what the reason behind that it is completely look like a pulsatilla. So graphite is similar like pulsatilla. So all carbons are stable, but the graphite is changeable in mood and has a wavering mind and inconstancy. So this is a difference between the graphites and the carbons. Now, the property of the iron or a ferrum. So, like a ferrum, it is a sensitive and offended easily, and therefore the right brain dominance and the left-sided. So, left-sided is because of the iron. Like ferrum, it has a pseudoplethora or erythemisms. It means though anemic, it has a redness of the face, a congestion of the face, especially before and during the headache. So as we have seen in the carbo-wage rule out pointing, whenever you find there is a congestive phase or there is a plethora on the face, you can directly rule out the carbo-wage. But whenever you find that the pseudoplethora or a congestion of the face, especially before and during a headache, then you can think of carbon, but not the carbohydrate. The graphite. Like ferrum, it is sensitive to the odor, especially of the flower and the wood. So again, the graphite is very, very sensitive to the flower and the wood odor. Even ferrum is sensitive to the slightest noise. Even the paper crackling can be affected the ferrum very badly. So when to think of graphite is in the clinic and how the graphite is present to you in the clinic. So physically the we all know that fat flabby people who are very chilly and constipated, large, hard not stool, and suffering from having a previous complaint of the skin with the glutinous discharge. So this is what a one-liner from all the Materia Medica book that the fat, flabby people's chilly constipation and the chronic skin affection with the gluey discharge, you can think of the graphitis. The second point, when we shake hand with the patients, a strange hardness or the roughness of the palm draws our attention to the graphitis. So most of time the graphitis hand becomes very hard and rough. So there is a hard callosity like hard thickening with obese people with the soft and flabby hand, you can think of Kilkiria calf. Obese people with the hard hand, you can think of the graphitis. Obese people with the hard hand, think of Calcarea floor. So Calcarea floor has also hardness, graphitis also have hardness. So this is what you have to understand whenever the persons shake hand with all of you. So people who have a thick, crippled, default nail, cracks at the mucocutaneous junctions like a nostril, mouth, eyes, people who have a scaly dandruff, cracks behind the ear, hard, crusty scales on the eyelining shows the dandruff and the hair fall. You can think of it is a graphitis. So the sphere of actions of the graphitis specifically on the keratins and it produce thickness at the level of the keratins or there is fickleness or the keratin has been reduced at the level of nail. So nail becomes crippled, nail becomes deformed and also it produces at the actions on the mucocutaneous junction. So it depart that mucocutaneous junctions and produce the cracks and dryness at the level. Also it act on the hair keratin, so hair become rough, dry, scaly and dandruff. So this is what the graphitis is. When we see the people who are chronically sad, so graphitis is a chronically sad peoples. You can think of graphitis. So sad, melancholic people with a long-standing grief who are anxious, weeping type, and who cannot take firm decisions due to timidity and cautiousness. So whenever you think like this, the long-standing grief, whenever you think of long-standing grief in your mind, the remedy comes is the ignatia, the remedy comes is the natrum mute, the remedy comes is the acid pause, but you can keep mind in yourself that it is a graphitis can be very, very long-standing grief remedy. Even aurum mat having a long-standing grief remedy. So sadness, timidity, cautiousness, and carefulness. People who become obese due to the long-standing grief, this is very important understanding. Obesity comes after the long-standing grief. This is what the psychosis started after the hurt and they go into this state. People who get physically tired due to the mental work, the oxygen in carbohydrates are used to do mental work. causing hypoxia typical of the carbons, resulting in the less oxygen in the blood and in turn return into. So whenever you find the person's tendency to yawn, tendency to stretch, and tendency to blue or black discolorations of the neck, very important understanding that this is what because of the hypoxia, and that is what the carbons is. That is what the carbo is. Because slowness of the circulation lead to this hypoxia, resulting in this. So that is what graphite is. Again, people who hate flowers and hate music because of sensitivity. The girl in whom menses are delayed, menarche is too late, or even a regular menses is late by a month due to PCOD, you can think of it is a graphite. So very important nowadays when cases of PCOD comes to a clinic, you can think of graphite is one of the best remedy in this. The people who are timid but passes sarcastic remarks, a young girl who having a PCOD, and when someone is taunting for the obesities and everything, and she is indirectly passes a sarcastic remark, and that is what you can think of it is the graphite is. A middle-aged man who had a brilliant academic career but never succeeded in life and lead a very simple, non-luxurious life, not because they are contented, but because they have no desire to put in hard work. You can think of graphitis. Young boy who are fat and flabby who prefer to undress and stay with no clothes above the waist and wanting pants straight on them can be a graphitis. So very important. Clothes sensitive to the abdomen. Very important. The graphitis is one of the The young children who are insolent, impertinent, and laugh at reprimand can be aggravated. So this is what very important in nowadays. Gen Z generations, people comes to you and they become insolent, impertinent, and laugh at reprimand. You can directly think of it is aggravated is one of the remedies. So people who are mocking sarcasm, indolence, although very intelligent and sensitive abdomen clothes. People who have a tremendous sexual desire, but the body does not support their mind, it means they have a weak erections, they may have a premature ejaculations, and after poisons, aggravations. So the ejaculation, seminal discharge, failing during poisons, erections troublesome incomplete, and erections troublesome incomplete poisons during. So you can think of this. The mind level sexual desire is high, but body cannot perform properly and may lead to weak erections or premature ejaculations or after persons aggravation. You can think of it as a graphitis. The throat symptoms when everything centers around the throat. When everything centers around the throat, like the goiter with difficulty in swallowing, sensation of lump in the throat causing patient to swallow continuously, spasm in the throat while swallowing, causing the patient to retch and throw out the food, you can think of it is a graphitis. So let me share with you a sir's case. A lady aged 55 years old came with a complaint of dysphagia, difficulty in swallowing. She was examined by the allopathic specialist and the condition was diagnosed as achalasia cardia. Her complaint had started about 3 months back. She could not eat her food normally. Sometimes she could swallow, and sometimes a severe spasm in the throat interrupted her swallowing, and the food would be vomited out with the retching. She came in for homeopathy because her spiritual guru had advised her to do so. She was a fat, chilly lady living in the ashram monastery. She had given up her worldly life to serve God and the Guru. She was very young, about 25 years of the age, when she had come to this place after her married life failed and she had nowhere else to go. She was not very happy about her life, but she had no other options. Sir asked her, where you always be obese since childhood? And she says, no. She said, I was quite thin, but after a few years since coming here in the ashram, I become fat. That maybe because there is no physical work here. So that was the lame excuse by the person, but you have to understand how the psychosis has been started in the patient. So sir asks, what type of work do you do that? So uh, patient says, I have to teach the younger girls and give them a discourse on the God. They all like my teaching because I take pain to read and prepare my lecture before I deliver them. They like my lectures because I introduce some new topic every day, but after the lecture, I get so tired and fatigued that I start feeling hungry and cannot remain hungry. So I go on jogging. I think that has made me fat. Shows that she was intelligent but could not bear the mental exertions like carbon. She was intelligent and indolent. She could not bear hunger. She remained a teacher and never become a leader of any group because she said, I could not play politics. I am a straightforward person. I know what politics goes on in this ashram, but I prefer not to bother. I asked, you prefer not to bother, but you are bothered, isn't it? That was her question. He said, yes, even I am a human being. Even I want to progress and came up in the ashram, but I don't. Then Sir asked, why can't you fight and rebel and come up? She said, no, that's not me. I can't fight. If someone raises the voice, I start weeping. I weep throughout the night and it lasts long. I am very, very sensitive. The leadership perhaps is not meant for sensitive people. I cannot take firm decisions. I cannot exert. I cannot command. How can I become a leader? So that is what the personality is. So she was very, very timid, frightened easily, had an easy weeping tendency, wavering mind, and irresolution. So this is what from few lines you can inference the dispositions. Then sir asks, do you ever show your discontent? So she said, yes. I pass a sarcastic remark so that the message is delivered. So that is what the personality is. So childhood history shows that she had a chronic fissures which was troubling her and which was operated upon. After this, she had put on weight. Chief complaint was spasm in the throat, causing her to retch and vomit. That means reverse peristalsis. Thus, the patient is in a destructive miasm, that is a syphilis. The severity of spasm shows the destructive tendency. The patient's very nutrition is hindered, and this acute spasm is in the muscles due to hyperirritation of the nerve. This was syphilis in full-blown form. So, what was the psychosis? So her slowness, her obesity, indolence, intelligence, timidity, fearfulness, sarcastic tendency all represent the psychosis. Note, it is dangerous to prescribe on the psychotic pictures. Very important. Sir has always put a note that it is dangerous to prescribe on the psychotic picture. If we place our prescriptions on an early psychotic picture, it is very dangerous. If our simillimum suppresses the psychosis, the genetics of the patient will switch into gear of destruction, and this will means that she will definitely develop cancers if she is not already having it today, or else she will go into further constrictions of the throat and esophagus and will land up in the emergency. With this psychotic picture, we had to match her syphilis and psoric picture. So syphilitic pictures may and may not match because all the remedy have not been proved to a great destructive effect on the organ. So Sura is mother of all miasm and has to be covered. Psychosis or syphilis is nothing but the development of the Sura, and this means that the acute spasm, syphilis, as well as the fat indolent stimulated psychosis is basically developed from the Sura, the need. So her historic picture of the anxious being timid type with the fissures that was operated upon confirmed the graphitis that cured her forever. So the need of the graphitis in childhood is a safety and I cannot bear disharmony. So this is very important. This wants the harmony in the family and the safety in the childhood. That was the graphitis. Now how the genetically reflections of the miasm in graphitis. So the first defense process of the inflammation, the SORA. So at genetic level, the courage will be sacrificed, and this causes graphitis to be a timid, fearful, cautious, and careful. In order to protect itself, it has to develop this defense, and be sensitive so that they know when danger is coming. They always anticipate danger, therefore, there is constant anxiety, and that too of a trifle. So, this anxiety coupled with the timidity and helplessness causing them to be sad and weep easily. Physically, also, the sensitivity is developed in confections, that means sensitive to the odors, especially strong odors, perfumes, odor of the wood, etc. The skin becomes sensitive and the rash develop. The rash develop in places where the skin moves the most, that means in the fold of the joints, elbow, knuckles, fingers, toes, or in the groins, palms, tip of fingers, and the corner of the mouth, nostril, eyes, anus, etc. The cautious and the timid skin of the graphitis does not want to move and therefore primarily inflammation develop or a rash develop. Body is reflections of the mind and does not flood. Now, this second defense goes into a construction that is the psychosis. The second defense at the physical level, that sensitive skin exfoliate and the cracks. In order to repair the delicate skin or reinforce it, the genetic mechanism takes two steps. First, it increases the albumin and the gluten synthesis and start producing a sticky glutinous honey-like discharge that could help to stick up the fragile tissue. This gluey sticky discharge is the characteristic of the graphitis because of albumin and gluten synthesis is there. Second step is taken by the genetic mechanism to thicken the skin tissue by increasing the synthesis of the fibrin, and that is what the hardness is. This excess fibrin resulting in the hardening of the tissue and causing fibrosis and the scale as well. This hard tissue is, after all, not elastic and hence breaks still more easily to produce a characteristic deep syphilitic crack with the bleeding on palms, fold of joints, corner of the mucocutaneous junctions, etc. Also, the PCOD, the psychotic defense in the girls resulting in delayed menses, the fibrin causes heart tumors and the fibroid in the uterus. So these are the second genetic defense mechanism. The second genetic defense mechanism at the fat metabolism also alters, so fat start accumulating, giving rise to obesity. Being a slow and having a slow metabolic rate, BMR is low, heat produced is low, and heat need to be consumed. So excess fat is put on, act as an overcoat. For graphitis, friction is to be avoided. Very important. The friction is to be avoided. For this, everything stiffens and smoothens. The slowness of the metabolism makes the intestines also sluggish, giving rise to a chronic constipations. Stool have more fibrin that makes it hard again, and to avoid the frictions, the hard stool are surrounded by the glutens. So that is what a sticky gluey discharge. A stool with the hard stool with the gluey discharge. The slowness of the carbon extend to the circulations and oxigenations and may give rise to hypoxia. In order to get oxygen, he starts yawning and stretching. This slowness causes one to crave for open air and become intolerant to the clothes on the upper part. Though chilly, they crave for open air like the carbo waste. So this is what one of the understanding of the carbon level. The second defense mechanism at the level of mind, the psychosis of the construction. So psychotic trait being very prominent and exhibited right from the childhood or right from the stage of the sora, making the patient so timid, cautious, careful, indolent, although intelligent. The psychotic aggressions in this timid person is expression in the form of mocking and sarcasm. So very important the mocking and sarcasm. You can think of others. The prolonged grief and the sadness of the graphitist uses a lot of mental energy, causing him to be discouraged easily. On the other hand, the graphitist can become haughty, feel he is a great person, and having the ambitions for the fame, sexual desire get increased with the relative weakness of the organs to perform. And finally, when this goes into a third defense process called as the destructions or the syphilis, so at physical level, the process of destruction from the skin causes raggeds and the cracks. Then hardness or cicatrices become a cancerous. This is what the syphilitic aspect, and the cancer develop in the breast. It is the syphilitic aspect of the graphitis. General levels, the carbohydrate is the food or a need for the brain, An intelligent mind always require more of the carbohydrates so that the brain cell functions well. The fats are the secondary need to protect the delicate body. A very funny trend exists in the graphite is the skin or the cuticle that gives protection to the body is sacrificed and the skin gets cracks and fissure in order to save the whole. So graphite is busy synthesizing more of the albumins and the gluten that require more of the proteins. Thus, this upset the total balance between the protein and carbohydrate and fat. The carbohydrate and fats are thus thrown out or not taken in. Thus, the graphite is developed aversion to sweet and aversion to fat. This is what the correlation between this. The sweet causes nausea, so they cannot consume sweet. They have aversion to fat, plus fat is thrown out in the urine to give a fatty cuticles forming on the urine. So this is what the basic understanding of the graphite is. Now, how the mentally sora turn into syphilis, the anxiety turn into anguish in the ladies if menses do not appear, weeping sadness goes into despair, or sensitivity goes into insensitivity, resulting laughing at reprimand. So this is what the mental picture from Sora to syphilis. Physical weakness and the fatigues makes the person's desire for the external energy, thereby resulting in desire for magnetism. Destructive process hamper the senses of awareness and recognitions, the power of the intellect. So this is what the syphilis is. Now, sharing the case of the sir, so it help us to understand how graphite people are. So there was a lady aged 48 years of a menopausal age who came and complained, doctor, when I go to the marketplace, I feel all the people around me are from some other planet. I feel they are all aliens. She was asked, does everything, it means the building, the shape, the shop, the car, the vegetable, everything look different and from some other planet? She said, no. When I am walking and I see people whom I know or the vegetable vendors, I feel they have come from some other planets. I also feel that I myself am from some other planet. So she was a fat, crabby, mild, chiny, and menopausal with a history of the skin eruptions in the past. This feeling that she was from some other planet was taken as a rubric from delusion. Things are strange. So in front of the anything, the everything looks strange. The intellect and the recognition power was affected, but specifically to the familiar things only. So she went to vendors, vegetable vendors, and she feels that this vegetable vendor is something like alien or from the different planet. So there are the two rubrics, delusions, everything is strange, and delusion, familiar things are the strange. These are the two rubrics are there. So delusion, everything is strange, where the cars, the roads, the buildings, the vegetable types, everything will appear not normal and not from our planet. That means a strange remedy. So it is not in this patient, but here in this patient is delusion. Familiar things are strange. That means here her power of recognition and awareness is affected only in so far as the people whom she is familiar to are concerned. Here we have a cannabis, indica, sativa, populus, graphitis, nacmosata, platina, and pulsatilla. So we have the syphilitic part of these constitutions. Now we need to zero in on the simillimum by finding out which remedy covers the psychotic and sodic trait. So cannabis indica and cannabis sativa are the fast remedy and she is slow, hence ruled out. Platina and pulsatilla were ruled out because she was chilly. We are left with the slow chilly remedy, the cocculus, graphitis, and nux moscata. So nux moscata is drowsy, which she was not. Cocculus is compromising, that she was not. So above all, graphitis is the only one that covered her sora of the skin lesions that was suppressed beside being anxious, mild, and timid. So graphite cured her or her as it covered all three defense adopted by the patient's genetic code at a different time all throughout her life. Now, you have to compare certain remedy with the discharge and differentiation. So here the glutinous discharge. So we found that glutinous discharge is found in many remedies like kali bichromicum, pulsatilla, natrum, natrum sulf. So what could be the difference between them? So all kalis they differ from graphites in the pure speed because kalis are fast, whereas carbons or graphites are slow. Hasty with the startling tendency and aggressive in nature in kali. Kali bichromicum, who was stoically built like graphites, will never have dry, scaly, scabby, cracked skin. So that is what the difference between Kali bichromicum and graphites. The pulsatilla, again, the graphites is chilly, pulsatilla is hot, thirstless. Graphites is chilly, thirstless. Pulsatilla loves consolations. Graphite is worse by consolations and weeps more when consoled. Natrum and natrum sulf both have sun aggravations, whereas graphites like warmth of sun. Natrum loves sweets, graphites hates sweets. Sweets causes nausea. Natrum mure is hot, natrum sulf is hydrogenous. These are the few differences between the glutinous discharge and the hardness of the skin. So again, in hardness, there is a different remedies that have tendency to hardness at the level of mind as well as at the level of body. So in hardness, there is a natrum mure, aggravation consolations. Then ammonium carb is a timid, angry, shortening tendency and irritable. Calcarea floor had also a hardness, and due to hardness, there is a floor has attachment with the money, luxury, bones, prominence, and there is accumulations of the money. Graphite is having a hardness with the fat, chilly, indolent, and skin affection. So you can think of this hardness with these two remedies. Now, the genetic reflections of the graphites. So, sensitivity of graphites in repertory, the rubric of graphites, we see that graphites is sensitive to and has ailment from anger, vexations, ailment from anticipations, ailment from discord between chief and subordinate, ailment from discord between relatives and friends, ailment from emotional excitement, ailment from fright and fear, the grief, sorrow and care, ailment from notifications, humiliations and chagrin, ailment during puberty, very important, and ailment from the mental exertions, mental work or manual fine work. So these are the things that affect the graphitis. If we see above factor that causes graphitis to fall ill, we see that it includes almost all emotions like anger, pride, fear, grief, and mortification. Besides the emotions, the graphitis cannot bear mental work and the fine work and discord in the relationship. So this shows that graphitis does not want anything that bothers his brain and is always wary of such things. This is what makes him anticipatory and this anticipations and tensions makes him ill. The most important positions here are anticipations and the discord. This means the graphitis wants no discord and always wants harmony. So this is what you have to understand. The basic need of the graphitis is harmony and the safety. So this end with our reading of the graphitis. We will continue with the petroleum tomorrow. And by the end of this week, we will conclude this book. Any questions up till now? So we conclude the day today. Hope you learn something and apply this knowledge into your practice so that it will help you to get better day by day. So thank you so much. God bless you. Thank you all. We conclude the day today.